everybody, I'm Dr. Darpan Kaur, and in this video I'm going to talk about the instructions that you need to follow after you've had a tooth removed, and more importantly, why you need to follow them. So without further ado, let's get into it. First, 30-minute pressure dressing. Now at the time of the extraction, your doctor is going to place a piece of cotton or gauze at the site of extraction and ask you to firmly bite on it for 30 to 45 minutes. Now why do we need this dressing? Obviously to stop the bleeding, but there is another very important reason. Now once the tooth is extracted from the socket, blood fills the extraction socket. We need this blood to form a clot. This clot will further lead to bone formation in the socket. While a blood clot usually forms in 3 to 10 minutes, it takes at least 30 minutes for 60% of the clot to stabilize, so that it doesn't get dislodged by gentle minimal forces. Make sure you don't leave the dressing in for too long though, because then it can just start to become a source of infection. Second, have ice cream. Now this has to be the most fun rule to follow. Ice cream or cold food items are a way of performing cold compressions on the inside of your mouth, which are usually done using ice packs when you sustain an injury on the outside of your body. Ice cream also helps minimize any swelling which might occur after an extraction. Third, soft and cold diet to be consumed for 24 hours after extraction. Please avoid hot food or beverages. Consuming hot food or liquids like tea and coffee can lead to a drastic increase in swelling within the first 24 hours of any dental or maxillofacial procedure. Moreover, biting on hard food items can not only cause more trauma to the already traumatized bone, but can also dislodge the clot that we worked very hard to stabilize. Fourth, do not consume soft drinks, fizzy drinks, or alcohol, as these can damage the clot. Fifth, do not spit, use a straw to drink your liquids, or smoke. Now these may sound silly, but they are in fact one of the most important rules to be followed post-extraction. These activities can generate a negative pressure inside your mouth, sort of like a vacuum, and end up dislodging the clot that is not 100% stabilized at this point. In addition to that, smoking causes our blood vessels to constrict, which may lead to reduced blood supply in the area of extraction and once again cause the clot to disintegrate. Smoking should be avoided for a minimum of 3 days after extraction. Sixth, warm saline rinses are to be initiated 24 hours after extraction. So let's break this down real quick. The warmth does two things. First, it causes your blood vessels to expand, and this leads to increased blood flow in the area, which helps wash out any inflammatory mediators that cause pain. And second, the increase in temperature causes your white blood cells to migrate to the area of extraction so as to fight any potential infections. Now coming to the saline part, the salt in the water not only helps reduce swelling but also increases lymphatic drainage in the area. All of this leads to quicker healing. Seventh, no intense exercise or physical activity. Avoid lifting heavy objects, as this can restart the bleeding. Finally, have painkillers prescribed to you by a doctor for a minimum of 2 days. This provides adequate reduction in inflammation in addition to relief from pain. Please note, your doctor will never tell you not to brush your teeth. You can still brush your teeth the next day, making sure that you rinse your mouth gently without actively spitting. In fact, it is important that you maintain your oral hygiene so as to avoid any potential infections. If a clot dislodges for whatever reason, a condition known as dry socket can occur, which is characterized by intense pain at the site of extraction 3 to 5 days after the procedure. Should such a symptom occur, make sure you contact your doctor, because this will require their attention. Minor bleeding from the site of extraction is to be expected for the first few hours. However, if you find this bleeding to be excessive or continuous even after appropriate time has passed, make sure you consult your doctor immediately. Medical histories play a crucial role in healthcare, so make sure that you're honest with your doctor if you're suffering from diabetes or any other health conditions, have had any surgeries done in the past, or are on any prescription medications, so that your doctor can treat you with the proper care that you deserve and can prescribe you medications accordingly. With that, I'll wrap up this video. Hope you found the contents helpful and informative. Don't forget to like this video and please subscribe for more content on orofacial health. Bye-bye and see you next time.